Today, I just want to talk quickly about workplace mental health and how it presents itself in the office or in the business. I get a lot of questions about this. And there's a normal state, and then there's kind of an extreme state, and both of them are something that we should be aware of and concerned about in the workplace. So I want to use this bell curve graph real quick. Now, on the left-hand side, you see that this is a unanxious or a kind of a free state. This is unencumbered, right? But where the shaded box is, this is where a lot of the people find themselves a lot of the time. Now, this doesn't mean all the people all the time, but what it means is that when there's a stimulus, an issue, a trigger, a problem, a lot of people will find themselves sliding into this quote-unquote normal state in the middle, meaning that they're experiencing some level of emotional or psychological distress. Now, that could come from a multitude of things, at work or at home. It could be a bad relationship with a peer. It could be a performance review that didn't go well. It could be a bad relationship or something going on with the boss or a project that's overwhelming. It could be from home, right? It could be caring for an elderly parent or a relationship issue, or maybe a cherished family pet has passed. When those things happen, it is normal to have psychological distress. It's normal to have mental challenges, maybe sleepless nights or worry, or slight levels of anxiety or depression. The challenge that we're seeing today is that when that's left unaddressed, is that more people are sliding to the right, meaning that the stress left unaddressed is compounding and it's growing, and people don't know how to deal with it. They're lacking the coping skills potentially to reduce that stress and slide back to the left. So as it grows and compounds, literally people are starting to slide to the right, and now we're experiencing higher levels of emotional distress on the border, if not crossing into clinical or diagnosable anxiety, depression, bipolar disorder, which is now needing intervention, right? It's needing professional help. It's possibly needing medication. And so the idea is that this is very controllable. So in the workplace, what we want to do is come up with opportunities. We want to come up with options so that we can help people live their best lives. We help people not only enjoy the moment, but they have the power and they have the feeling like they can cope with the stress and slide back to the left. So that's really our responsibility in the workplace. And it'd be very challenging to address any and all problems, but we certainly have the ability to put in mechanisms and parts and pieces to be able to help people along the way so that they can deal with their normal levels of stress on a daily basis.